Hello, everyone. My name is Kate Godovan, and I'm a physician assistant here at Jefferson. Today, we'll be discussing GLP-1 medications, also called glucagon-like peptide 1. So let's jump in. First, I want to mention that this video is just intended to provide additional education for those already prescribed a GLP-1 medicine, so please do not make any changes to your medication regimen without first speaking to your healthcare provider. Let's start by understanding what GLP-1 is. GLP-1 stands for glucagon-like peptide 1, which is an important gut-related hormone. It will help to stabilize your blood sugar during the day, as well as improve your appetite. Generally, my patients often mention when taking these types of medications that they feel like their brain has told them that they've already eaten. Many describe it as if their appetite volume has kind of been turned down, overall improving their hunger cues throughout the day. Additionally, it will slow down your digestion, and this can help you feel full sooner as you're eating. And lastly, it helps to improve what we call insulin sensitivity and your glucose control generally throughout the day. And this can be very effective for those with insulin resistance or prediabetes or diabetes. There are many different brand names of these types of medications, which are listed here for you. The first medication was approved in 2005 by the FDA for the use of diabetes initially, and then in 2016, they approved them for weight loss purposes, initially Saxenda, and later down the road, Wegovy as well. There's an additional medication called Mounjaro, which has a similar effect, but is slightly different. The brand that your medication is just depends on the individual patient, and you can discuss this more at length in your individual visit with your provider. Next, let's review some potential side effects with GLP-1 medications. Regardless of the brand, all of these GLP-1 medications come with a risk of potential side effects that we want to keep you fully informed about. To start, these types of side effects tend to get better over time as you continue on the medication and tend to be more mild in nature. They usually would occur as you just started the medication or if we've just increased your dose. So be sure to pay attention if you are having any sort of potential side effects, as that may indicate that we need to adjust your dose accordingly. These side effects can include things like nausea or vomiting, abdominal cramping, bowel changes such as constipation or diarrhea, reflux heartburn, or fatigue, headache, or injection site reaction. These are all things that, again, should get better over time as you adjust to the medication and to that dose, but especially if anything's persistent, such as abdominal pain or vomiting, you're going to want to notify your medical provider, as there's a very rare side effect called pancreatitis, listed in less than 1% of patients, which would include that upper abdominal pain and vomiting. If that would occur, you would simply stop the medication and notify your medical provider so we can make some suggestions on moving forward. Additionally, we do not recommend this medication if you have a personal or a family history of medullary thyroid cancer or multiple endocrine neoplasia 2. There are plenty of ways to avoid side effects when taking these medications. And the first is by staying well hydrated with plenty of water. You'll notice you're hydrated by not feeling thirst throughout the day and by making sure that you're urinating clearly. This hydration will make sure that you can help to avoid constipation when on the medication. Additionally, you want to be very mindful while you're eating, noticing when you do feel fullness, as if you eat beyond that sensation of fullness, that's where you might run into things like reflux or nausea on the medication. Particularly the types of foods that we eat on the medications can trigger side effects, such as alcohol, sugar, a lot of starchy foods, greasy foods. Those might bring out more side effects than typical when taking this medication. You also want to notice if there's any specific food triggers for yourself and try to cut back or avoid those whenever possible. If you do have any sort of persistent side effects, please reach out to your medical provider so we can advise you on changes to make, such as adjusting your dose. You should not put up with any persistent side effects, especially if they're impairing your ability to drink water or to get in adequate protein, because we want to make sure that you're preserving your muscle mass on this journey. Patients often ask us how long you should take these medications for. First, I want to start by saying they are FDA approved for long-term use in the management of obesity. And that's because we know obesity or excess weight is chronic and relapsing. Anything we do for weight loss, whether medication or lifestyle changes, we have to be able to sustain and maintain in the long term in order to maintain that weight loss. And so with that said, we manage obesity and excess weight just like other chronic health conditions like high blood pressure or high cholesterol. As often with those conditions, you continue on the medications that are used to help manage them. Of course, over time, we can always reassess your dosing to adjust it as needed over the long term. Thank you for your attention. We are honored to help you on this journey to more optimal health, and good luck as you get started on a GLP-1.